Call Jim Allister.
Myself with the remarks condemning the threat to the First Minister. First Minister, it is surely always important to remind ourselves of how alien these oppressive regulations should be to all of us, and to also be mindful that though we are all paid from the public sector and therefore do not have the financial prejudice, that there are many across this country in the private sector who are suffering and will continue to suffer because of these regulations. Now, you tell us that all this is necessary because of the threat, in your words, I think, of our National Health Service falling over. Is there any acknowledgement collectively from the Executive that we're in part in this position because since devolution returned in 2007, 2,000 beds were taken out of our hospital system with the attendant nurses, etc. Is there any acknowledgement of that? And when this is over, will we begin to correct that and put things back to where they need to be to deal with the pandemic?
I think if the Health Minister was here, he would absolutely say that that is the case. It's part of the problem in terms of capacity of our health service. And of course, the member will know that we had started a programme of transformation and reform, and unfortunately, given what has happened this past year, we haven't been able to proceed with that transformation and reform agenda because it is so important to have that capacity. And it's not just about beds, and the member has recognised that. It is about the staff to be able to deal with the people in the beds, because of course in intensive care I think the ratio is 1 nurse to 1 bed, and at some points we have had to lower that ratio for 1 nurse to 2 beds, and that's dangerous, and we don't like doing that, and the Health Minister doesn't like doing that or anything around it, but we need to have more skilled nurses. There has been an increase in the number of nurses training now. Obviously that takes some time to come through, but it is important that we continue to invest in our health service, but also to have the transformation and reform agenda which is there and which is needed. Otherwise we're not going to be able to deal with a health service into the future.
Jim Allister, supplementary.
Today again I listened to the Deputy First Minister pontificating about how important it is that the public follow the rules. That will cause many of my constituents to want me to ask this question. If another terrorist friend of the Deputy First Minister should die in the next few weeks, will she be attending their funeral?
Well, I would encourage the Minister to encourage his constituents to work with the public health advice, to follow what we're asking of the public today. We are all in this together. We are facing this crisis together, and it's really, really important that we respond together.
I call Jerry Carroll.
I want to condemn the threats made against the First Minister as well, Mr Speaker. I wanted to ask the First Minister, though, when discussing these regulations a few days ago, you stated that none of this was inevitable before going on to chastise people for